Oh, hold up. All right, that's okay. Let it go. You think? Is everybody muted?
Can you see?
Mm-hmm.
Can you see my screen?
Yes, we can.
Okay.
Yes.
Can I start? So I'm going to start. I'm not an expert, so this is just a definition of systemic sclerosis, diffuse inflammation of the nerves, immune deregulation, scarring, fibrosis of the skin and internal organs. In my specialty, 90% of these people have gastroesophageal reflux, diarrhea, or severe constipation, or a mix of them. There's interference with social life and depression, extremely, extremely important. Reflux may present very early. What we call heterogeneity or differences of scleroderma affect the many tissues, make the diagnosis very early extremely difficult. Overall, the treatment, as per the experts, I will stay only on the GI tract, and we will complement with the other experts. There is not a good drug medication to abolish or sometimes to even ameliorate esophageal damage or function. There are dietary guidelines, which is the first line of therapy. As per this standard that we call the Nutritional Risk Screening of 2002, A is undernutrition, according to the standard. B is estimates for the disease or disease severity. Number 3, remember, very important to remember for people that are not expert, that all the pro-inflammatory molecules called cytokines are elevated in patients that are cachectic or malnourished. And if this is recognized, the whole thing can turn around, as you can hear the other speakers. But in my experience, sometimes these patients that I see are extremely malnourished, and therefore they go into the vicious cycle with increased cytokines. The diagnosis of early gastroesophageal reflux and gastroparesis is extremely important, just because of the previous statement. The medications that we use are checked also to prevent drug interactions, since in my experience, many of these patients have already been seen by more than one specialist, and the list of medications is very long, so I have to be careful to avoid drug interaction. The medications that have been considered metoclopramide, domperidone, erythromycin, cisapride, ondansetron, which is Sofran, and PPIs like omeprazole, Nexium, etc. The total failure of the diet and medication, which occurs in extreme cases, required a percutaneous endoscopic jejunostomy for enteral nutrition. This is a very drastic thing, but some patients are required. Overall, the gastroenterology disorders deal with dysmotility, which is the essence of the GI tract consequence. Sphincter dysfunction and vascular malformations, and what we call dysbiosis, which is heavy infestation of the gastrointestinal tract. Next. A lot of these patients that we see are already on probiotics. My own view is it has not been demonstrated that it works. It should be prescribed only as part of a general profile and dietary intervention. For intractable constipation, we use prucalopride, suppositories, glycerin, bisocodyl, and sometimes biofeedback although biofeedback has not been demonstrated to be the treatment of choice. It's still being investigated. Other drugs that we recommend, linaclotide, plecanamide, lubiprostone, misoprostol, colchicine, prucalopride. And in some patients, they have been tried biofeedback. And again, there is no double-blind study to say, but biofeedback is a good idea since it's not a medication. A very common thing, these people, almost 90% of the patients that I see have a small intestinal bacterial overgrowth, and it manifests with diffuse symptoms that are very difficult to investigate for the primary care without experience. And once we demonstrate that there's nothing else, then we use a course of antibiotics. Rifaximin is one of my favorites. Then the other thing that is important that I'm pretty sure is going to be touched by the other speakers is when your mind makes you sick, question mark. Ancient story is that King David in the Torah said that my guts, my brain is in my guts. And from that, it came that the brain-gut axis is being investigated. It makes a lot of sense. The gut microbiota, or the whole series of millions of bacteria, have evolved over thousands of years into a mutually beneficial relationship, contrary to what many practitioners that are not doctors don't care about. The gut and the brain communicate through the autonomic nervous system and the circumventricular organs, both in physiological and pathological conditions. This circuit incorporates the human experience, the state of the mind, and the gut microbiome, and the subsequent immune response. Thank you very much.
Thank you so much. Oops, hold on. There we go. Okay, were there any questions, anybody? If you have, please raise your hand and we can unmute you. Okay. Right here.
Who has
Yes.
their hand up?
James White.
Okay.
Mute, unmute.
Got it. I think I got it. Did I get it?
Okay.
Thank you. I'm so sorry. I'm on this site. My stepmother got me on. I'm really grateful to you, and I'm calling about this issue. Specifically, why I'm calling. I have never been sicker in my life with gastroparesis. The morning, vomiting and the constant going to the bathroom. I can't stop, but it affects what I believe is what he just mentioned. I feel it's not just the nausea. I feel like my whole body is like in shock. I can explain it. I get really, really hot and sweaty, and I'm on the ground, and my whole entire automatic nervous system is affected. I ended up with restless leg from this. And I'm just wondering what else can be done, what is recommended for this, because it is a disability, there's no doubt. Does he, I'm on the Reglan, I've taken the Zofran, I'm on the, the Prevacid, I'm on everything they could give me. I also have Barrett's, so it's a double-edged sword. But I'm just wondering, what else am I doing? Should I do acupuncture? Is that worth it? Does it really work?
Your question is that you have a lot of diarrhea, right?
I have a lot of diarrhea, but I have a lot of vomiting. That's what's killing me, is the
Okay.
nausea. And it's connecting to my whole, I'm sweating. I feel like I'm gonna die. No body.
Very, very, very important. When you have, this is what is called bacterial overgrowth, your whole body, instead of having billions, have trillions of multiply different organisms. And unless something is done manipulating the diet, for example, we use a low FODMAP diet, and the use of antibiotics, unless this is done, this is not going to get better. So
Antibiotics are used for this? I've never been on that. That's different.
yeah, for example, when diagnosis is confirmed, we do some confirmatory diagnosis to be sure there's no what we call pathogens, as people travel all around the world, and be sure you don't have any foreign bacteria in your body.
Yeah, they've
But
done it. Yeah.
which is very common, exactly what you said, is a tremendous distress for people. But that is the case where small intestinal bacteria overgrowth has to be investigated and treated, and should be treated as an infection, not as an inflammation. That is the critical thing on what you mentioned.
Thank you so much. That was very, very helpful. I've written it down. Thank you so much. This was
Thank
my
you, Lydia.
unit right here. I was dying to hear this. Thank
Thank
you.
you. Okay.
Okay, Susan, you had your hand up. Let me get to you.
Yes.
Okay, Susan, I'm letting you unmute. Okay, you're still.
Yeah.
mute. There you go,
I
Susan.
didn't have my hand up.
Oh, I thought you had. I'm so sorry.
Phyllis has.
No, I'm good.
Okay. Hold on.
I'll do it.
Okay, hold on.
Yes, I'm gonna handle it.
I think it's my first name. Okay, Phyllis, could you unmute? There you go.
Yeah, Dr. Lopez, I, of course, was diagnosed with scleroderma, and a new rheumatologist that I'm going to in Florida told me that he's never seen such a severe case of dysmotility. The doctor, my other gastroenterologist, and I'm also seeing doctors at Johns Hopkins in Baltimore, and they prescribed Trulance for me. I've
Which
tried
one?
many.
Excuse me? What?
Trulance,
Trulance, yeah,
Trulance.
yeah. Yeah.
What is your opinion of this drug for dysmotility?
Okay. There's a good number of drugs that are used for dysmotility. And the thing is very tricky because, for example, in scleroderma, you might have at the beginning dysmotility of the esophagus only, or even your mouth. You have problem in opening your mouth well and using your tongue and so forth. This is a kind of dysmotility in your mouth, but it could apply to any organ. In the esophagus, dysmotility, you have difficulty in swallowing, pain, and so forth. In your stomach and your colon together, and in your rectum together. So the broad use of dysmotility to be used for treatment has to be localized. Which part of your whole system has more dysmotility?
It's been diagnosed and it's in the colon area, the upper intestines.
At the upper intestine. For example, by definition, you have 100% a small intestinal bacterial overgrowth. If you have a slow transit, your bowel doesn't empty. You have bacteria. And if this is not treated, the dysmotility agents are not going to work.
I've been on a lot of different antibiotics and they never helped. Trulance seems to be the only thing that helps somewhat.
Okay. Have you seen a dietitian?
My son's a dietitian.
Without criticizing, do you know the name of the diet that is being applied to you?
There's no specific diet because I've tried many different things and nothing really works.
Okay, what really works in your diet that you think?
Sometimes, I'm also very constipated. So I do eat some roughage. And if I eat too much roughage, I develop severe pains in my stomach. The food doesn't digest properly. I get extremely bloated. I get dry heaving. Those are my symptoms.
And that is a common mistake. Ravage should not be used. You need soluble fiber, not ravage. Anything that is thick, anything that is green and thick is going to stay there forever. It's going to make symptoms worse. So we all need fiber, yes, we do, but in scleroderma, you need soluble fiber.
So, okay, all right, I'll tell my son and he'll give me a diet, soluble fiber.
Please. Thank you.
Okay, thank you.
Thank you.
Okay, anyone else
Gwen,
have some questions? Gwen?
Hi, thank you.
Hey, Gwen.
Hello. I have been trying to find probiotics because I know how important, your gut brain thing is. I believe in that 100%. But a lot of the probiotics have a warning on them that if you're immune compromised, you shouldn't take them or you should talk to your doctor. And so I haven't spoken to my doctor because I see him next month, but I'm just curious if there are specific probiotics that do you stay away from some? Do you ask your doctor? I don't know how to go about picking one.
Okay, the state of the art and the state of science. The conclusion is there's nothing proof that the probiotic works. We think that the probiotic is a good idea, but if you're going to take probiotic, we have to assume that this motility that has produced overproduction of your own bacteria is not going to be displaced by another bacteria that might be detrimental. So in conclusion is we don't have scientifically proven that probiotic works in this mind or on the other side and so forth. It makes sense. Yes, it does make sense. So what we use with probiotic, we use, for example, a line that is not expensive. And my advice is, okay, let's try the probiotic. You try it for 1 month or 2 months, and then you stop it. When you stop it, you allow your own bacteria to regenerate and reaccommodate. But you cannot 100% replace your own bacteria with probiotics. So probiotic forever is not the answer. It has to be given by 1-2 months time and then so.
Align is the one that I noticed had the strongest warning on it. Maybe they
all
have
have warnings.
backside, but
Yeah, and they all have warnings, but the main thing is you cannot take a probiotic forever. It should not be. You want to try for a month. There's no way scientifically that we can do it. If I wanted to help you and I said, okay, you know too much, how can you help me? Okay, let's do a small intestinal count and see what bacteria do you have. It will cost you like $200,000. It's not done in the United States. So we use common sense only. One day it's going to happen that we can culture and see exactly what bacteria you have and what not to use and what to use. But we are far away from there yet. It will be coming there, but not exactly at this point.
thank you.
Linda? Hold on, Linda. We're going to get you in here.
Okay, my question is, have you heard of this supplement called Atrentil? I can show you the bottle, Atrentil, that is marketed as helpful for small intestinal bacterial overgrowth problems that are primarily methane gas dominated.
Yes.
It's a combination of quebracho, horse chestnut, and peppermint leaf. And I don't, I haven't really tried it. I've heard of it, read about it, and I'm just curious.
Yeah,
Supposedly it's, yeah, sorry.
I've had the same questions about this product. Going back to my statement, there is nothing scientifically proven yet that this product is going to be the answer. So this is not going to kill you because it's not poisonous. So you wanted to try, first of all, you have a good dietitian that's going to give you all the supplements and vitamins that you need. You want to try this product, you're on your own, but you're not going to try it forever. You can try for a month and that's it, and see what happens.
But no, I mean, you take it for a couple of weeks and see if it helps.
Yeah, that's all. No probiotic or any substitute like the one you showed me should be used forever. It's impossible, not scientifically advisable.
Okay, what about just yogurt?
Yogurt has probiotics and the same answer. You try the yogurt, but it stops, say, after 1 month or 2 months and take it intermittently. Yogurt is a very old probiotic, but we don't know if in scleroderma where there's a problem with overgrowth of bacteria. If you take yogurt all the time, that's gonna help. We just don't have the answers scientifically.
Anybody else have any?
Any more hands? Okay, thank you so much, doctor. That was very informative. And guys, great questions. Appreciate it. Thank you. Thanks so much.
Thank you for the invitation and good luck to all of you. Keep on.
Thank you.
We all want you to get well, okay? 100%. Thank you.
Thank you so much. Okay. Dr. Maya, you ready to go?
Oh, yes, ready. Share the screen.
He's still on sharing the screen. right? There we go. Okay, great.
So hello, everyone, and thank you for having me. This is an honor. If you don't hear me well, please let me know. This is just some quick information about me, just if anyone is interested. Just 2 things I wanted to highlight. I had the opportunity to work in interstitial lung disease for some time, research-wise. And because of this, I've been in contact with scleroderma patients for a while. So that has given me the opportunity to learn a little bit more about this challenging disease. And also, I work for a free clinic, free rheumatology clinic. We see patients that don't have an insurance. So if someone in the audience or know someone who needs rheumatological care and don't have an insurance, they can always contact us. The phone number is there in case you're interested. This is for Palm Beach County. I don't have any disclosures. We're going to be discussing a pretty complex topic. As you guys know, it's frustrating for the patients, for the family, for researchers, for doctors. Then it's kind of heavy on the eyes a little bit, what the information we're going to be looking into. I'm going to be just putting a few pictures, random pictures around so we can rest our eyes a little bit. This is just my city where I was born, and we're famous for salsa. That's the picture you're seeing there.
Doctor, could you speak a little bit louder or turn the volume up? Some of the people are having difficulty hearing you. I'm sorry.
Let me try a little bit closer to the microphone. Better? Any better at all?
Yeah, that's a little better. Yes.
Okay. So I received a few questions from the audience, so I'll try to answer those questions as best as possible. This was the first question. Can someone have scleroderma-related issues or symptoms and not have scleroderma? As in issues with internal organs and vessels, yet not affecting the skin tightness? What do the labs show? And interestingly enough, another question actually answered the first one. So I'm going to tackle those 2 questions at the same time. So this was the other question. Can you explain scleroderma sine, symptoms and diagnostic criteria as opposed to the other types? So for me to answer these questions, we're going to look into the different types or subsets of scleroderma. So there's 4 main ones and there's 1 localized. So the localized is known as morphea. And we have the systemic ones, which are the limited, the diffuse. Then we have scleroderma, sine scleroderma, And then we have systemic sclerosis with overlap syndrome. The first one, localized, also known as morphea. So this is very localized, as we can see the picture, just one area, one or more areas of the skin, but it's very well limited. These patients, even though they mainly have the skin part, they can also have some systemic symptoms such as Raynaud's, joint pain, some lung involvement, and some esophageal involvement, mainly because of fibrotic bands. The limited cutaneous systemic sclerosis, formerly known as CREST. Here, a lot of the patients have one or more of the manifestations of CRESTs, which is calcinosis, which is the calcium deposits under the skin, which feel like little pebbles. Raynaud's, as we can see in the picture, fingers turning really blue, really white, or really red, with cold exposure or with vibration. Esophageal problems, sclerodactyly, which is the finger skin getting very thick, and telangiectasias, which is the cherry red spots or little spider blood vessels in the hands and the mouth. And this type also can have pulmonary hypertension. The diffuse cutaneous systemic sclerosis is the generalized scleroderma. Here, the skin thickening extends to different parts of the body. And in this type, we see lung fibrosis. In the other one, we see pulmonary hypertension. Here, we mainly see lung fibrosis. Not everyone gets it, but it's more common in this type than in the others. We also see kidney involvement, and we can also see heart involvement. Then we have something known as systemic sclerosis, CNS scleroderma. So this is an interesting type, which is probably underdiagnosed. We have the organ involvement of scleroderma, but we have nothing or little skin involvement. We have divided into three types, 1, 2, and 3. 1 is no skin, 2 is a little skin, and 3 is when skin starts appearing later after the internal organs have been involved. Patients can definitely have Raynaud's. Patients can have little pits or ulcers in their digits, and they can have any type of organ involvement. Labs are usually abnormal, and we're going to talk about the labs a little bit later. And the main lab we see centromere, and we also see SEL70. The other or the last subset is when scleroderma is mixed with other rheumatological diseases. Lupus, rheumatoid arthritis, polymyositis, or Sjogren's. Here we see findings of scleroderma, but we can also see findings of any of these diseases. Different rashes, different type of joint pain, different type of joint swelling, muscle inflammation, dry eyes, dry mouth, etc. Just to take a quick break, this is called Seven Color River. This is in Colombia. This is caused by the different vegetation in the river. Famous place to visit. Next question. Is it possible to have a positive ANA, a positive SEL70, and a negative centromere? What would this mean? So for this, let's just try to understand a little bit what is an ANA. So ANA is known as anti-nuclear antibody. So our body produces antibodies to protect ourselves from infections and foreign objects. Sometimes your body makes a mistake and it creates some of these molecules and they can attack your own cells or your own body. So that's what it's an ANA, an antibody that is attacking your own body. ANAs are common in many diseases. As you can see, it's a little bit heavy on the eyes, but as you can see in scleroderma, 95% of patients with scleroderma do have a positive ANA. Also means that 5% don't. But many other diseases have a positive ANA. And out of 10 people, 10 completely normal people with any type of diseases, 3 of them are going to have a positive ANA. So an ANA gives you, tells you there's something you need to look into, but it doesn't tell you what it is. Then we move into ENA. ENA, extractable nuclear antigens, are pretty much a subset of ANAs. And among this, we find the ones that have to do with scleroderma, but also of other diseases. This table just shows a few of them and how often are in the other diseases. We don't need to focus on this too much. We're going to see the ones related to scleroderma next. So these are the subtypes of ANAs or ENAs that are linked to scleroderma. This is what we test for when we're trying to find if someone has scleroderma or not. The first one, anti-SEL70, also known as anti-topoisomerase. We have anti-centromere, anti-RNA polymerase 3, and then we have other subtypes that are usually not measured unless we're not sure what's going on. I'll just talk a little bit about each one. Well, I'll try to be really brief. So this one, anti-SCO70, also known as anti-topoisomerase, most commonly seen in diffuse cutaneous systemic scleroderma. As you can see, there's no consensus how often we see it. Some studies say 26%, some studies say 76%. It can also be seen in the limited forms, but it's less common. This one is linked to interstitial lung disease, also known as lung fibrosis. And it is also linked to renal disease, what is known as scleroderma renal crisis. This is something that is usually triggered by steroids. So you're gonna hear me saying this a couple times. Steroids greater than 10 milligrams of prednisone are not a good idea in scleroderma patients. So we should always avoid steroids or prednisone at more than 10 milligrams. Then anticentromere. This is very common in the CREST syndrome. So it's more common in the limited cutaneous forms. It's seen in 50 to 80% of this type of patients, and it's only seen in 5% of the diffuse forms. This one is linked to pulmonary hypertension, and renal disease is less likely in patients with. This one is less known, but it's actually fairly common. We see it in 10 to 15% of our patients. I had patients in my practice that they come with all the typical symptoms. They said they've been tested, but they turn out negative. And when we test them for this, they come back positive. So we do see it a lot. These patients with this type of antibody can have a lot of skin involvement, at a risk of having kidney problems, but should also be screened for cancer. Cancer is a little bit more common in this patients with this marker. So if you have this type of marker, make sure you get screened for all the regular types of cancer. Then we have some more obscure antibodies. These ones are usually seen in people who have additional immune diseases. So scleroderma with muscle involvement or scleroderma with other types of immune involvement. This is the Tayrona National Park. It's located in the north part of Colombia. Beautiful beach, beautiful jungle, nice place to visit. The next question. Is peripheral neuropathy a complication with systemic scleroderma? If so, could you please discuss symptoms and if symptoms could be confused with skin tightening in scleroderma, lower extremity? So neuropathy is actually not too common in scleroderma. 1 to 6% of patients with scleroderma develop some form of neuropathy or nerve damage. And these are the types we see. We see trigeminal neuralgia, peripheral neuropathy, carpal tunnel, multiple mononeuropathy, which is injury to many of the nerves, lumbosacral radiculopathy, also known as sciatica, and small fiber neuropathy. And it's very difficult to really assess if they're secondary to scleroderma or to something else. That's why we don't have like a good grasp of how common this is. What are the symptoms of neuropathy? Burning, tingling, and numbness. These are very, very similar to what patients experience with Raynaud's. So even though skin tightening can feel sometimes like this, and patients are going to be the best ones to tell us if they are feeling this, it's actually more similar to Raynaud's. So if you're experiencing this, it could actually be more Raynaud's than actually the skin tightening part, but it could be both. And this is just something else I wanted to discuss is that actually more common than neuropathy is myopathy. So patients with scleroderma can definitely have muscle involvement and muscle pain. So sometimes something that might seem like it's nerve pain, it can be actually more muscle pain. And it's not the same as muscle weakness because a lot of our patients have muscle weakness because of the skin tightening or because of different medications or different causes. But this is actual muscle inflammation causing muscle pain. And as you see, no one really knows how often it is, how frequent. They describe 5 to 96% of patients. This is the Wall City in Cartagena, old colonial city, beautiful. People love to go there to get married. It has remained there since the time of the Spanish conquer. I believe this is the last question. Is hydroxychloroquine still considered a good medication to treat scleroderma? Please compare with others. So this is probably the most challenging question for today. As everyone else knows, scleroderma does not have a good treatment. As Dr. Lopez was also saying, there's just not good treatment for scleroderma or for many of these manifestations. This is a good list of all the medications that we use. When we do use them, it's all based on what type of scleroderma or what manifestations of scleroderma you're having, because not all of them are correct for each type or for each group of symptoms. Hydroxychloroquine, also known as Plaquenil, is mainly used if you're having joint pain with the scleroderma. It's a mild medication. Don't expect huge improvement with this. It's mainly done for patients who have mild symptoms. Methotrexate, used in a lot of immune diseases, is used mainly in scleroderma when there's skin involvement or joint involvement, but be careful when there's lung involvement. There are some cases of methotrexate-induced pulmonary fibrosis or pulmonary inflammation. Mycophenolate, known as Celsat. It's a transplant medication, but it's also used for skin, and a lot of the recent studies have shown that it's actually pretty good for lungs too. So patients with lung involvement, usually we would put them in this. Cyclophosphamide, stronger medication, mainly used when patients are not responding to other treatments, but also it doesn't guarantee any type of improvement. It's mainly used in the longer part of scleroderma. IVIG, immune globulin. So these are antibodies given through the vein, have been used, some improvement in some patients, but again, nothing drastic. Rituximab. Rituximab is an antibody that stops B cells, also used for skin, for lungs, and for other types of scleroderma. But again, everything is just kind of anecdotal or small groups of patients, nothing consistent. Tocilizumab, also known as Actemra, recently being used more for lungs and for skin. It's a medication initially used for rheumatoid arthritis and for something known as vasculitis, which is blood vessel inflammation. Again, just small cases, nothing dramatic. Low dose steroids can be used when there's a lot of joint pain, a lot of muscle inflammation, but again, low dose. Ideally less than 10 milligrams of prednisone. Never more than 20, because it can trigger a renal crisis, which is an increase in the blood pressure and rapid damage to the kidneys. Azathioprine, also known as Imiran, another medication used a lot in rheumatology. In some scleroderma patients is used, especially when they have a lot of muscle involvement. Other rheumatoid arthritis medications that perhaps you've seen on TV, such as Rinvoq, Enbrel, Humira, they have also been used in scleroderma. But again, it's based on what's going on with the patient, mainly with patients who have a lot of joint, a lot of muscle manifestations. And last but not least, stem cell transplant. So some centers around the country are starting to do stem cell transplant for scleroderma. It's a good treatment, has shown good results, but it's complex and it can have its complications. The mortality of this procedure, based on who does it and which type of transplant it is, ranges between 4 to 10% of patients. So it's more like a last resource. This is the Amazon jungle. I've been there, beautiful place to visit at some point in life. Greatest jungle in the world, the biggest jungle in the world, and the largest river in the world, which is the Amazon River. And I think that was the last question that had been submitted. Please let me know if there's any other questions.
Okay. Questions? Doctor, can you stop sharing so we can see, we need to see our whole screen and I can see who's asking questions. There we go. Okay,
Question?
go ahead, Linda.
Low-dose steroids. What about steroid injection for like sciatic pain? Not, it's not an oral steroid, but just the epidural to help with back issues. Is that contraindicated?
It's also not ideal because a lot of that is actually absorbed and becomes systemic. I would ask if you're going to do it, just discuss with the doctor who's going to do it, what dose they're going to use, and if possible, to use the minimal dose. It's less common because it has to do more with how much dose you accumulate over the days, and that is just usually a one-time thing. So it's definitely less common, but it's not completely risk-free. So the main thing I would recommend if you're getting one of those procedures, whether it's an injected steroid like for sciatica, is that monitor your blood pressure after the procedure for the next week or so. If your blood pressure starts jumping up significantly, it might be the renal crisis, and let your doctor know immediately. But again, less common with the injection because it's usually like a one thing, but it's still, there's a small risk.
Okay.
Anyone else? I'm sure, I can't believe we don't have more questions now. Go ahead, Judy. Hold on one sec. We're gonna get you. Did you click on her picture? Judy.
Go ahead, Judy.
Hi, thank you. I have limited, but I understand that a percentage, perhaps small, of limited patients end up with systemic sclerosis. Does that mean that the laboratory results end up changing? That the, that all of your, that the profile that you gave ends up changing, or what's the story with that?
It's a great question. And the short answer is there's no good answer for you. Why? Both things can happen. Yes, you can develop new antibodies over time, although it's less common. If you have centromere, you usually will not develop SCL70 and vice versa. It's more that we don't understand antibodies correctly. We don't have all the information. So even though you have an antibody that is more common with one type, it doesn't mean you have more things going on in your body that can later on change over time. It's not too common for it to happen, but it can happen. You can develop from a more localized form, you can develop a more diffuse form.
Jeanette. Hold on, Jeanette. We'll get you on in a sec.
Jeanette, unmute, please.
There you go.
Good morning, Dr. Myers. Is it possible for a patient to have tested positive and treated for over 2 years and then go to a different doctor and be told that you don't have scleroderma?
You're asking a very challenging question. Yes, of course, it's possible for multiple reasons. One, the one we don't want to admit is we made a mistake. We said you had it and you really didn't have it. That happens for all diseases. So it's a possibility. Second possibility, something changed in your body. There's unusual cases where you initially show like something, and then over time, it turns out being something different. So initially, the first doctor who saw you thought it was scleroderma, and then whoever saw you again saw something new, and they were like, hey, this is not quite scleroderma, this could be something different. So human mistake is there. So either the first doctor or the second doctor made a mistake, or just your body changed over time. Could your body have gone into remission from treatment? Possible, but you know how scleroderma behaves. It's usually a long-term disease, so it's low likelihood.
Yeah, that person is me, but I have GI involvement and pulmonary involvement. So I don't know.
You can have another form of scleroderma as we discussed. You could have scleroderma, sinus scleroderma. So if you only have the GI and the pulmonary and not the skin, one of the other forms that are mixed with other diseases, like mixed connective tissue disease, which can have pulmonary and GI, but not much skin. It all depends on. There's no specific way to diagnose a lot of these diseases. If you look into into all the literature, they never give you diagnosis criteria. They give you criteria to put people in studies, but not to make a diagnosis. So making an exact diagnosis is never easy. So that will be my guess, that you just don't have the typical findings or the typical blood markers. So they have not been able to give you a precise diagnosis.
Thank you.
You're welcome.
Okay. Hold on.
Great.
There you go.
Am I on?
Yes, go ahead.
I'm on. Okay, I have a question about myself. I was diagnosed by I can't pronounce her name, Naomi Rothfield from UConn about 15 years ago. She walked in the room and diagnosed it. She had all the records prior to me coming. I had one positive something in one hospital, but it's not consistent. positive, then it goes negative. But my symptoms are so consistent. So they're going with the diagnosis. They go with the nail fold test. Does that make sense to you?
Yes, yes. As you saw in the chart with the antibodies, not everyone has the antibodies. Or sometimes you can have the real obscure ones, the ones that no one measures. The other thing that happens with antibodies is that over time, the level goes up and down a little bit. They might go low enough that that lab cannot measure them because they're low enough, they're there, but they're so low that the lab cannot measure them. But yes, in the rheumatology world, we have a lot of people with all the typical findings, and the lab just doesn't add. So it happens.
Thank you.
Another thing is that there are diseases that mimic scleroderma. This is a whole different topic, but there are diseases that look exactly like scleroderma and are not scleroderma. So that also can happen.
Lisa,
Thank you.
unmute yourself. Thank you.
Thank you.
Hi, my name is Lisa. I'm new and I was just get diagnosed with scleroderma maybe 2 weeks now or 2.5. I know on my blood test it showed the THTO. That's the only thing which is elevated on my blood test. But also in July I was diagnosed with Sir John syndrome with a different blood test. So my question is, if the THTO is the only one which is elevated that shows scleroderma, what type would I have? Because I noticed before then my hand, like the palm of it is burns. It doesn't change colors or anything. My joints are affected, meaning I have a lot of joint pain, but I thought it was the Sir John because I was diagnosed earlier and I showed symptoms in this hand, but this hand more since the last few weeks. So my question, because there is different type of scleroderma, what do you think would, because mine on the blood test is only the THTO is elevated.
So THTO definitely can be seen in scleroderma, but also in other diseases. It does not necessarily give you a specific type of scleroderma. So in your case, will be more based on the symptoms you're having. And there's not a perfect line between the different types of scleroderma. Many people have mixture of them, or someone else was asking, you can start with one type and then kind of look more like the other type. Just with the blood work, it will be very difficult to say what type you have, especially with THTO, not specific for any.
Yeah, because my current rheumatology, I have multiple autoimmune, like the GI. I have a few GI issues which is autoimmune. I have Meniere's disease which is autoimmune. I have some of the lung. So I have a long list of most of it which is immune based or autoimmune disease. But so when she did this particular blood test, she was like, with the THTO, it's scleroderma. The only medicine she's given me is one that she started in July, which is the HY, that long one for Sir John syndrome. She kept me on it because I saw her last week. She kept me on it, even though now she diagnosed me with scleroderma. So I'm kind of like trying to learn, confused, which is which and what to do. I did a test on my lungs. I'm waiting for the result. I'm doing a test on my heart. But I have so much issue going on where she's trying to put the pieces together because I'm one person with a lot of autoimmune illnesses. Yeah.
Yeah, and we do see a lot of patients like you where it's just different pieces. They're not like the perfect book description with scleroderma, just like different pieces that we know it's something there, but we just cannot put them together properly. So when that happens, more than trying to find out the exact type, is just kind of working with the symptoms you have. So if your lungs are involved, then we will try to treat you with something that mainly helps the lungs.
Okay.
Hydroxychloroquine is used a lot for Sjogren's, but it's also used for people who are having some of the joint pain. Less effective for the skin part. So if you have the skin part of scleroderma, hydroxychloroquine wouldn't do much. Definitely does not help the lung. And as far as I know, but the GI doctors know more than me, it doesn't benefit the stomach either.
Yeah, my GI, I'm on a FABMAT, gluten-free, no sugar, no dairy, low salt. Is a long list. But I also take this medicine because I have the colitis with the IBS. So I have both. And then my lungs, I have asthma, low lung function. It's kind of like different part. I have a long list of medication, but it's kind of like, okay, what's going on? Even though I'm getting some answer, my thought is like, okay, all of a sudden my hands are being affected. And I'm like, what is going? Is it scleroderma? Is it Sir John with scleroderma? So how can somebody let me be treated? And I know I have 15 providers and all of them are in another era of, what's wrong with me. But I'm like, is there just one medicine that can cover all or, me or what, this is my questioning. So anyway, thanks.
There's no one treatment that will cover everything.
Mm.
This thing that we do is just try to find one that covers as much as possible without causing harm. That's also something we have to do. We need to make sure that we're not harming you by adding more than one medication. I mean, we do combine medications, but we have to do it.
All right, thank you.
I see Judy, but was there someone else that had their hand up? Okay, go ahead, Judy.
Unmute.
Oh, okay, I did. I understand. I'd like to know the distinction between immunocompromised and having an autoimmune disease. I have since been successful at
Good
getting my
question.
third vaccine, but
Good
when I
question.
first went to get it, when they first opened it up to people who are immunocompromised, I was turned down because I wasn't on the government's list having scleroderma. And the pharmacist at the time didn't consider, according to, what she had, this to be immunocompromised. Can you tell me the difference or the distinction or whatever information you might have for that? Thank you.
Sure. Another great question, especially nowadays with the vaccine.
Yeah.
So there was a definition given by I think it was the CDC, where they said that if you had an autoimmune disease, actually, but you were not on treatment, you were not part of the immunocompromised patients. So that was the definition given by the CDC for vaccine purposes. For general
treatment.
purposes, patients with autoimmune diseases such as scleroderma, we know their immune system, know that they don't have the immune system as someone without the disease. They are more prone to infections, they're more prone to cancer, so we know their immune system is not perfect. So if you ask me, and this is just my personal opinion, someone with an immune disease is immunocompromised. Not as strong as someone who is already taking the treatment. Someone who is on treatment such as methotrexate, mycophenolate, cyclophosphamide, those patients are truly immunocompromised. Hydroxychloroquine, not so much. Sulfasalazine, which is another medication that is not used in scleroderma, but some of you might have heard it, not so much. So hydroxychloroquine and sulfasalazine don't count as immunosuppressants. All the other ones do. But again, for me personally, anyone with an immune disease is someone whose immune system is not working properly. But that'll be your own immune system is attacking itself. Immunodeficiency is your immune system is not defending yourself. So it's just, I guess there's just a fine line between the two of them.
Thank you.
Great question, Judy. Daryl, did you have a question?
Unmute yourself, Daryl.
Me?
There you go. Go ahead.
Okay, I'm sorry. I've been dealing with CREST syndrome for about 20 years now, and my symptoms come on really slowly. And anybody has ever heard of self-amputating fingers? Yes.
It happens.
I've been treated with an antibiotic, and it messed my hearing up. It's taken my hearing away. It's called gentamicin, and I've seemed to have helped really well, but had a devastating consequence. Is there any, and I'm allergic to 25% of the new treatments they've come out with. My wife's my caregiver. Is there anything you can add?
You're allergic to methotrexate.
I'm allergic to
azithromycin, Reglan, anything that helps with digestion. Yeah,
the say it again.
methotrexate.
Say
You're
it to
allergic
them.
to it.
I'm allergic to
Methotrexate, azithromycin, and Reglan, which helps with the digestive problems.
Yes, and also I was wondering if we have several immune systems or just one immune system.
Let me start with the question first with the immune system. So
Sorry.
let me start with the question on the immune system. So our immune system is let's call it one because it has the same genetic information. but it's divided in several parts. And each part has multiple components, millions of components. So even though it's like one immune system, because yours is not the same as your brother, for example, it does have multiple components. And regarding your question about the digits and the medications, if you're on gentamicin, and again, I don't know your case, but this is what I will be my understanding. It's because either you have not responded to other antibiotics, or because people who have frequent infections, which can happen in severe cases of Raynaud's, they become resistant to antibiotics. So I think that if they went for gentamicin, it's because you were not responding to the other ones, or because they did a test where they found out that the bacteria in your digits or in your body was not responsive to the other antibiotics. Gentamicin is known to cause deafness. Yes, it's a known complication of gentamicin.
And then,
Sorry, go ahead.
I'm a 25-year electrician, and I've been told that the silica inside the concrete and drywall, I was allergic to that, and it was causing symptoms. It'd be a trigger, which I had no idea of. And I think that played a role in helping this thing along, make me take my job away. In other words, I cannot continue being a.
Yes, there's some reports of silica and other components triggering immune diseases such as scleroderma. So yes, there's some reports. It's hard to say if that's what did it or not. It's just very difficult, but yes, there's some reports.
And for others that do have it, I have the delayed emptying, esophageal dysmobility. I believe it's going into my digestive system because I can feel it in there. And everybody should get the endoscopy once a year to check to make sure everything is okay. And then,
problem with the esophagus, sometimes known as watermelon stomach, where you bleed a little from the stomach, are very common in scleroderma. So I completely agree with you. Everyone should definitely check with a GI doctor and have a follow-up with a GI doctor.
yes, thank you.
You're welcome.
Okay, thank you. And okay, any other questions? We can't see everybody, so let me see. Anybody else have a question for Dr. Maya? Go ahead, Jeanette, hold on.
Unmute yourself.
Carol Lee has a question also. We'll get her next.
Quick question. Dr. Maya, do you do virtual appointments?
Not for first visits. I tried it and it's just, we don't get the same information as with a face-to-face.
Okay, and where are you located?
I'm in the West Palm Beach area, Lake Worth.
Okay. All right.
Closer than Mayo Clinic to you, yes?
I used to work there, yes. I used to work there, but I left for South Florida, yes.
Okay. All right, thank you.
The information if you'd like.
Yes, thank you.
You're welcome. Okay, let's find Carol Lee and get her. Carol, there she is. Okay.
Hi, I feel like a baby compared to all the other attendees that are here. I've had scleroderma since 2010, and I was put on Cellcept with my rheumatologist, and it seems that has worked for me. The only problem I have is my hands are like arthritic, and that's the only problem. Otherwise, I'm knock on wood. I've survived, and I have, but I've listened to that. I'm leery about all these other symptoms that come out of scleroderma. So I will keep a close watch now that I know about these things. I thank you very much.
It doesn't mean you're going to get any of the other symptoms because it's
right. Yeah.
And like that, but it's a good idea to at least yearly get a good checkup.
Yeah, I go twice a year to my rheumatologist, and then I have a gastroenterologist who always takes care of me also.
Excellent.
Thank you very much.
Anybody else that we can't see?
No hands.
No hands. Okay, I just want to say, first of all, thank you so much, Dr. Maya. That was fabulous presentation. And for all of you down here, the clinic with creaky joints is the John Weldon Clinic. I have the information. If anybody needs it, I will send it out to the group. Because of Dr. Maya, I got in touch with Barbara, who runs things over there. And it's a wonderful, wonderful thing. So if you guys know of anyone who needs treatment and doesn't have the finances, it's a great option for you. So I'll send you the information for that. Anybody, anything else? I don't see any more hands. It's kind of tough here.
Daryl?
Good one.
Go ahead. Dave.
Yeah.
Unmute.
Oh,
Oh, you're muted again, Daryl.
there, okay, sorry, I'm a first time, so I'm sorry, everybody. I stay constantly ice cold. And I became anemic already a couple times in the last year, twice. And does that play a role with scleroderma at all? Because I'm on Coumadin as well because I had blood clots 2001. And I don't think that's related to CREST syndrome is what I've been told by my rheumatologist. And I've been seeing the same one for 15 years now.
But anemia is that?
Anemia is what I'm wondering if has any relation to scleroderma.
There are multiple causes for anemia. Scleroderma can have anemia for two big things. One, as we discussed, the scleroderma patients can bleed a little bit from the stomach, microbleeds, and even worse for someone who's on a blood thinner like you are. So that'll be one of the first recommendations. Make sure that your GI has been checking on you and making sure you're not having microbleeds on the stomach or the intestine.
They have.
They have.
They can't find
They
it.
have. And they can't find the source of.
They think it's one of these inside his esophagus, the tanglia.
This is the T and
Jesus.
CREST syndrome in my forehead here.
I have it too.
You can
And I
get
have
that.
them all over my hands.
I have them here and here.
Oh,
Yeah, and
Blood-
they tell me it's
Here.
down the esophagus.
That could be worse.
Yes,
Okay.
it's blood thinner. I mean, scleroderma patients tend to bleed a little bit more with the skin component and for example, the esophagus. But you've been on warfarin, you're just going to bleed a little bit more. The other reason that people with scleroderma, patients with scleroderma have anemia is there's something known as anemia of chronic diseases. When your body is chronically ill, or also in a lot of the medications we use, your body does not produce the same amount of red cells. So that's another possible cause, but there's multiple causes of anemia. Nutrition problems, problems with bone marrow, the blood, losing blood from different places. So there's just many causes. It's not easy to sometimes to find the cause.
Okay, and I really
Beautiful.
appreciate that. Thank you.
Beautiful.
So
Jeanette?
Hey, Dr. Maya, I have several questions and I just wanted to know, is there any way that I can call you and we can talk? Because I've been to two, different places and I am really, really confused. My body tells me one thing, a pair of doctors and specialists tell me one thing. Now Mayo is telling me different. So it's like, I don't know what to do, and you're really far from me.
Which Mayo Clinic are you going to?
I went to Jacksonville. I live in Orlando.
Okay. What did you see there? You don't mind me asking.
I'm sorry?
Who did you see at Mayo Clinic? If you don't mind me asking.
Which doctor? She is like an Indian doctor. She's a rheumatologist.
Narula? Neha Narula?
I don't think it's.
No, never mind. I just thought if it was someone I knew, I could tell you how if they were like if it might have been a good approach or not.
Mhm.
Well, I mean, definitely, I can give you our office line and I can call you to work. Usually, I make calls towards the end of the day. but without kind of more information, it's very difficult. I mean, without the.
I mean, I have all the results and everything, because just last week I had a manometry done, a barium swallow. And I just have several things. And this one doctor, I saw her many years ago, and she's telling me that it's my fibromyalgia. But meanwhile, you know, it takes many years for you to get diagnosed with scleroderma. And I went through all of that at UCF with rheumatologists. I have a great pulmonologist. He says I have GI, pulmonary involvement. Dr. Vinar here, he's an awesome GI. He says I have scleroderma, GI involvement. So it's like, I don't know what to do. And I swell up, I don't know.
I mean, yeah, I'm happy to take a look at, but I think that what I can provide you at a distance is going to be limited. It sounds like you've seen all the right people, at least. And you probably have one of those cases that is just not, that's not typical. So that's why have not been able to find a great answer. I'm happy to do it. I mean, I can give you my office number. Give us a call. Just let them know that you're from the Derma Foundation, and I'll give you a call and see what I can do for you. Okay?
Okay, thank you.
And I'll make sure you get the information. Proper.
Thank you.
Okay, everyone.
No, we got,
Oh, we got more. Okay.
Whiting, James.
Okay.
Waiting
go
to
ahead.
unmute. Where's the unmute? I
You're-
didn't get my,
You're okay.
You're
You're okay.
speaking.
I'm speaking?
Yep.
I have a quick question for you. I have the bad gastroparesis involvement with systemic sclerosis. I'm a nightmare. My hands are a nightmare. Everything's a nightmare. My question though, I went to Dr. Spiera in New York City. I think he's Mount Sinai or Columbia, one of them. He had recommended, please don't laugh at me. Don Perion is all I could think about the name of it is. It's not champagne. It's a medication that's not FDA approved, but used for the stomach. He had called and written to my doctor who refused to get it because of the FDA problem. What do you think of that?
No, it's a good medication. I mean, definitely GI is not my strong area, but it's used a lot in scleroderma, and it's used a lot in kids. Interestingly, it's used a lot for the reflux and for the.
So it's a good option. All right, thank you.
Yeah, a lot of people were getting that from Canada. In the support a couple of years ago, that's what they're doing, is they were getting it through Canada.
I have to see what I can do with that. Thank you so much.
Can you say the name of that again?
Don Peridon. Dr. correct me if I'm not sure.
Oh, that's
pretty much how it sounds. Peridon.
Yeah, they mentioned it to me too.
I can't get what you're saying.
I'll send it to you, Gwen.
You'll send it to me.
I
know you-
take it. I take it. I get it from Canada.
Judy, you okay? Because your Judy's from the that support group. Yeah.
Yeah, I
Wow.
take it. I'm given it by Dr. Elliot Ellis, gastroenterologist in West Palm Beach and Palm Beach Gardens. When he first put me on it, I asked him if it was to be a secret from my other doctors, since it's not a US drug, only from Canada. And he said no. So I give it as a list when I go to other doctors, but I take it.
Wow, that's great to know. I never knew
It
this.
works.
Thank you.
I think it's helpful. I mean, obviously nothing fixes anything that we have, but I do think it's helpful.
Great,
Worth a
thank you.
try.
I'm sorry?
Worth a try.
Namaste.
Okay. All right. Anybody else? Maybe we're going to flip to the next page, see if there's anybody with a hand up. Okay. No other hands. All right. Well, Dr. Maya, thank you so much again. Yes. Let's do the clapping. But we're a little ahead of schedule, which is fine. At this point right now, we're going to take about a 15-minute break so everybody can do what you have to do. And shortly after that, we'll have Melanie to present. Okay, everyone? We're still going to be here, but just to take a little break.
Thank you, Dr. Maya.
Thank you.
I gotta call my dad. I don't know what he's talking about. I did not make a question for wine.
1 minute. Okay.
I think it was good. I couldn't hear much.
It's you.
Only I can ask. Don carry on.
I don't want-
Oh my God. I wish I was dead. Hold on.
Unmute.
Oh, how sweet of Daryl. It's really nice now. Okay,
Okay,
let's-
participants. Melanie. More. Co-host. Yeah, okay.
Okay, we all back? All righty. Hi, Melanie, you need to turn your monitor on.
Yeah,
Got it?
not quite, but I'm gonna get it.
Okay.
I'm confident.
We love technology. There we go. Okay. Here we go. For those of you who don't know Melanie, Melanie's been a long time member of our board and also is the support group leader for the Palm Beach group. And she is a licensed mental health counselor. Is that a good title there, Mel? And
Yeah. Oh, I was trying to find my video so you guys could see me. I'm sorry. I apologize. There I am.
we can see now. We can see it.
Okay.
Okay. So without further ado, here's Melanie.
All right. Hi, everybody. So happy to be here today. Thank you for staying with us. I know you had 2 great presentations with the doctors. It sounds like you guys really got some really useful and beneficial information. So now we're going to do a shift. We're going to talk about the mind, our mental health. Hopefully with my presentation, we will leave feeling uplifted just from the whole experience today. And can everybody hear me okay, Fern? You can hear me fine? Everybody's good?
Yes, I think so. Everybody shake hands.
Okay, perfect. All right. One thing I'm not very is techie, but all right. So the name of my title is Pull the Weeds and Grow More Flowers in Your Brain. I'm gonna see, how do I do the next slide? Let me make sure. There we go. Oh, I just click in. See, I told you not very techy once I get it. Most of what I'm going to talk about today is based from this book by Rick Hanson. He's a PhD with Richard Mendius, MD. And the name of the book is The Practical Neuroscience of Buddha's Brain, Happiness, Love, and Wisdom. Because I know many of you like to read. This is a really great book if you want to, and I'll give you a minute if you want to. But just, you can always Google Buddha's brain. Thank goodness for Google. All right. So what we're going to talk about is only 1/3 of a person's strengths are innate, meaning that built into our genetic temperament, our talents, our mood, our personality. That's just kind of what we're born with. And you guys talked about that earlier, about your physical genetic code. That's true when it comes to who we are as individuals. But the other 2/3 we can grow and develop. The neuroscience of the brain, we're going to kind of spend a little time in the beginning of the talk about what this is. But I thought I'd mention real quick, a lot of articles are out there right now on the term resilience. And so maybe you guys have heard a lot of articles about resilience. And this kind of goes with the concept of resilience, but we know that resilience is the quality that allows people that have been knocked down by the adversities of life, and they come back at least as strong, or they learn and they become better. So I know all the scleroderma warriors out there, you guys are all resilient. And you know this definition of being knocked down and coming back. But one thing about resilience is we know that the more we're knocked down, the stronger we get. So I want to say that we do learn. So, we can recover. And that's encouraging for all of us, because I know there are times when emotionally, physically, you may be feeling, can I get through this? And that you resolve and you can come through. So let's go back to growing the good. So I say here, plant the seeds of inner strengths by repeating, taking in the good. And again, this is just kind of an overview, and I'm going to talk a little bit more about it. But we can train our brain to be positively self-directed, and we can create new positive neurons in our brain. All right, so it's important to know we have an ancient negative bias. The brain has a readiness to go to negative to help us survive. So if you think way back when, if we were lounging around and not hypersensitive to the danger around us, we would die. So he kind of explains this more in the book, but basically he said, we want to eat lunch, we don't want to become lunch. So in the survival of our brain, it had to be hypersensitive to negative stimuli, and it had to be perceived very rapidly and easily. So an example of this in his studies, we recognize people that have angry faces more quickly than we do happy faces, because we have to be on the alert when we're looking at our environment. Oh, that person's not happy. So we might tend to walk by somebody smiling at us and not give them a thought. But if someone's really angry or irritable, we would be more alert, like, oh, something's going on. Again, the brain is always looking for danger. Even when we're happy, it's on this negative bias alert. Okay, your brain is involved to learn, again, negative experiences. And one thing we know about negative experiences, it goes further into our long-term stored memory. So by going with my flowers analogy here, the soil of the garden is more fertile for weeds. So our brain is more geared to be focusing on negativity. All right. So there's a story of the two wolves. You might have heard of this, but I wanted to read it. It's called Two Wolves. There was an old Cherokee teaching his grandson about life. He said, "A fight is going on inside of me," he said to the boy. "It's a terrible fight, and it is between two wolves. One is evil. He is angry, envy, sorrow, regret, greed, arrogance, self-pity, guilt, resentment, inferiority, lies, false pride, superiority, and ego." He continued, "The other is good. He is joy, peace, love, hope, serenity, kindness, humility, benevolence, empathy, generosity, truth, compassion, and faith. The same fight is going on inside of you, and in fact, inside every other person too." The grandson thought about this for a minute, and then he asked his grandfather, "Which wolf will win?" And the old Cherokee simply replied, "The one you feed." Yeah, the one you feed. So that's an old, parable that's been around a while, but that's, to me, a good way of showing us how our minds can go to the negativity and our minds can go to the positive. All right. So the power of pain. Regions in the amygdala are designed to prevent the unlearning of fear. So our brain wants to remember pain, our brain wants to remember fear. So that is why some of you may remember some really painful childhood experiences more frequently than something that happened yesterday. This is a good one because I also work with couples, and for the caregivers that are on the call, it says lasting intimate relationships, you need at least 5 positive interactions to balance that one negative. So if you have that one fight with your partner, you have to make it up by doing 5 positive things. So I said this once to one of my clients, and the husband said, "Man, that's a lot of positive things I have to do." So, but people really do thrive when positive moments outnumber negative ones. So what it's saying here is we have to have a 3-to-1 ratio, 3 positives to 1 negative to negate that negative. So in the event, how you felt, it's stored primarily in our cortical memory network so that you can learn from it later. So what it's basically saying is we learn faster from pain than pleasure, right? And again, because our mind wants to remember hurtful things, none of us want to experience pain or fear. And I think it's important when the doctor was talking earlier, I was picturing all the doctor visits you guys do, all the information, all the changes, all the different things. So every time you go to the doctor, those experiences come with you, right? Those experiences revisit you. So you might find before you go to a doctor visit, you have a little more anxiety. You might be irritable, you might be stressed. But every time you have a positive experience with a doctor, that's going to negate that. And you're going to have a little more, it will kind of negate that negative part of it. Okay. So the suffering of the brain, staying with that. Again, our brain is involved to survive, but it also makes us suffer. We can get reactive when conditions are challenging. We may feel uneasy and dissatisfied and disconnected when conditions are fine. We overlearn from bad experiences. We return slowly to responsive mode when the coast is clear. That's kind of that stress management, that fight or flight or froze. And we become sensitized towards reactivity. We're going to talk a little bit more about that. So basically what happens is our brain remembers when we've been hurt again or had pain. And then we tend to connect these to new experiences when the new experience really has nothing to do with the old experience, but this is how we remember and learn. So the reactivity bias creates a vulnerability towards stress. So like I said, when I was using the doctor visit example, if you've had some negative experiences, the next time you go to the doctor's office, you're going to have that heightened stress response. That's the reactivity to what you're going to be. You know, will the people be nice? Will they pay attention to me? Again, this increase in negativity pulls your attention. It may make you over-report, overreact. You might have a vicious cycle of negative talk, increased stress. I don't know why I'm bothering to do this. Nobody knows what they're doing. No one can help me. We start getting kind of that negative self-defeated thinking. Instead of creating the experience as its own, it's a new experience, right? I may take something from this. And then it has a second negative bias it slides our attention past good or underreact to good. You know, basically what it's saying is the brain doesn't like storing happy experiences because it needs to save room for the fight, or it needs to protect us and remember when we've been harmed or something hurt us or caused us pain. It's real hard if you go for an infusion and it's painful and you know you need to go back because your mind remembers that it hurt, right? So you kind of have to prepare yourself to go back to know there's going to be some pain that will do good. Okay. If you are distressed about anything external, the pain is not due to the thing itself, but to your own estimate of it. And this you have the power to revoke at any moment. So I kind of like that power of like zapping it out, Superman. We all have the superpower. We all have the ability to reframe, and we're going to talk about it as we go on. All right, so what is this happiness of the brain? So just like we are geared to remembering negativity, pain, so that we can survive, we also can cultivate calming, the nervous system so that we can develop, you know, more happiness, prolonged feelings of happiness. We know happiness increases dopamine. It can increase your attention and focus. And it says here, experience-dependent neuroplasticity. Every time you take in the sense of feeling safe, satisfied, and connected, you stimulate responsive circuits in your brain. When you stimulate a neural circuit, it strengthens it. And I'm not really giving the brain the justice it deserves, because this is, you know, talk about complex of scleroderma and the immune system. The brain is, there's still so much of the brain that we don't know anything about. And we're doing a little, you know, it's constantly giving us information on to help us better understand why the brain works the way it is. So let's see here. So a responsivity bias is to help you stay centered, strong, healthy, and happy. We repeat internalized positive experience to build an inner strength so you can meet life's challenges without fear. So this kind of comes back to when I was giving you guys that definition about resiliency. It's kind of like we know what the definition of resiliency, but why does that work? Why can some people be knocked down? And I was reading an article about resiliency, and this is kind of what this is talking about. It's almost like the more we're knocked down, the more development we learn how to manage the struggle, the disappointment, maybe the negativity. We have more reserve to counter it with that. We made it through. It wasn't so bad. I improved. I did better. So we can grow each time. So there's no limit on building your resiliency. It says taking in the good shows you again and again, you're basically all right now. Increased positive experiences again grows your inner strengths. And by sensitizing your brain to take in positive thoughts, this makes good stick in the brain. Good stick in the brain. If you start to feel stressed, start focusing on the good. This begins the recovery process of reenacting that. And sometimes we're in a down place or we're going through a difficult time. It's hard to come up with what the good is. So we're going to do a couple of those. So one of the things that I think is really important when we're working on building our resiliency is love and compassion are necessities, not luxuries. Without them, humanity cannot survive. I don't know if this chat's for me, but let me look. Nope. Is everyone still saying thank you? Okay. So self-compassion is something I think as humans we don't do enough. And I wanted to throw this in there for you guys because love and compassion is not only for somebody else. Love and compassion is important for us as individuals, right? We have to be able to do the self-compassion. It's important, and that's part of us cultivating those positive and moments. So what is all this I'm yammering about and talking about? Well, there are some neuroplasticity techniques that are self-directed that can help you build more positive reserve. And these are some of the techniques: grounding, meditation, guided imagery, positive affirmations, healing sound. And I'm sure many of you have participated in doing some of these things. And in fact, we're gonna do a guided imagery in a minute. So I just like this quote because I thought this was a great illustration of, on the left, mindful. That's usually what our minds look like. And then over here, it has mindful. So when you hear that term mindful, that's another popular term out there right now that everybody's using, trying to be mindful. But being mindful is not simply just being in the present moment. That's what mindfulness means. It needs to be combined with goal-directed, active efforts to nudge your mind to grow in the direction you want. So basically what it's saying is when you get your mind in a state of calm, that's when you want to add a guided imagery or add a meditation, something more directive so that you can start processing to have a reserve of those places you can go that can lift you up when you're feeling down. All right. So this is a great exercise that I thought I'd throw it in here just to mention, but let's say you get a call from a friend, your best friend or a family member, a cousin, somebody calls you. And you just feel really good when you hang up the phone. It just feels nice, when you feel good, when you connect with somebody. Basically what it's saying is once you have this experience of a pleasure, they want you to kind of, when you hang up the phone, sit there for a minute, stay with that good feeling that you have at least 17 seconds. Just sit there and think about, I just feel so good because my friend called me, the things they said, I felt loved, I felt safe, I felt secure. Just kind of sit with it. And then it says, allow yourself to absorb it, not just from your head, but to your heart. Just really allow yourself to receive that gift. And then store it in your memory. So when you're having a day that you're feeling lonely, or you're just feeling like nobody cares, or Nobody really knows what you're going through. Try to recall, because now you've taken the time to put that good thought into your long-term memory. Then you can say, oh, I remember how I felt when my sister called me the other day. Because what he's saying about the negativity of the brain is a lot of times these positive experiences get deleted from our long-term memory. It never makes it there because the brain is like, we don't need this happy crap. That's what I say. He's like, we don't need this happiness. It doesn't make us survive. It doesn't warn us of pain. It doesn't tell us that there's trouble around the door. It's just happy. And so some of these things that our brain are hardwired for, we don't need anymore. We don't thankfully have to worry about a dinosaur or pterodactyl coming down our street to eat us, thankful. But, there are other things we have to be alert and aware of, but that we can again create. So I call this the fertilizer for your flowers, because we know weeds can grow in our brain, but we have to start cultivating our own fertilizer to get the happiness in there.
Oh,
All right, so I'm going to do a quick guided imagery. I think we're doing okay on time. We're already ahead of schedule. So one thing I like about guided imagery, and for the people out there that know me, I always do these because I love them. When it comes to just meditation, for myself, I'm not very good at quietness. My mind starts thinking about doing the laundry, my chores. I do much better if I have a script. And one thing great about technology, there's scripts right there on the computer. You can go on anywhere. But because today we're talking about happiness and how to connect with that, I wanted to put this picture of all these happy people together. So, and then I'm going to kind of read you guys. This is like a 5-minute meditation. I'm going to read a guided imagery just to kind of expose you guys to it if you haven't done a guided imagery before. So you can get comfortable. You guys are all at home this year, so just get comfortable how you want. And you can close your eyes, you can relax, whatever works for you. If you want to just look at this picture, if you want to look at me, that's fine too. Just where you're comfortable. But this is an example of my meditation I'm going to read is called Smile and Be Happy. So that's what we're focusing on. All right. So I'm going to give you guys a chance, just kind of, I'm going to tell you to do a couple of breath work, but you do whatever breath works for you, okay? So we're going to breathe in for the count of 4. And then we're going to hold our breath for the count of 4. And then we're going to exhale real slow at the count of 8. And your 8 can be whatever you're comfortable again with. So again, we're going to breathe in for the count of 4. And we're going to breathe out for the count of 4. Or hold our breath the count of 4, I'm sorry, and then breathe out. So let's do that again since I missed the step. So we're going to breathe in for 4. Hold for 4. And then exhale at 8, again, whatever you're comfortable with. And then I want you to bring your attention to your face. And are you holding any tension in your jaw, behind your eyes, or in your forehead? If so, allow these areas around your face to soften and relax. And allow your lips and cheeks to relax and begin to form a smile. You may like to think of something amusing or simply the love you have for your family or friends, or focus simply on whatever brings a happy memory or feeling. If you hold any tension in any part of your body, allow your smile to soften that area now. Allow the muscles to soften and relax. Stay as long as you need in each area of your body until you feel fully relaxed. When you have finished relaxing one tight area, move on to the next area that feels tight and tense. Again, remembering this happiness, the smile, that the muscles from your face are allowing you to relax and travel all the way down to those tense areas. Now bring your awareness to your heart and feel the smile and happiness in your heart. You may like to visualize your heart chakra opening or pulsating, expanding with love and energy. You may like to visualize this heart energy as a pink or a green light. The pink represents unconditional love, and the green light is the color of healing. Hold this focus for a few minutes, focusing on the love in the center of your heart. The following are some positive affirmations that help you feel even happier throughout your day. I am happy and relaxed despite my external circumstances. I find it easy to be happy and smile often. I am responsible for my own happiness. Happiness comes easily to me. When I smile, the whole world smiles with me. Now bring your awareness back to your face. As that smile is still there, are you feeling happier and lighter? When you leave this meditation, you will find it's easier to smile and be happier throughout your day. When you're ready, bring your awareness to your body. Give your fingers and toes a wiggle and open your eyes when you're ready to come back, or if they're already open. Just allow yourself to sit in your space and remember and reflect on how we started this meditation with a smile and recognizing the emotion of feeling of happiness. So that was just we've only been maybe a little over 5 minutes. But that's just a good example of helping our mind kind of focus on something besides all the things that it's constantly doing, and giving us intention of wanting to focus on something that makes us smile or happiness. I like to do talks on the benefits of laughter and humor. Those are kind of the same things. And I know we've had a guest before do that laughing yoga. There's a reason that those things just kind of make us feel better. Why we like a good laugh, why we like those memes on social media, why we like comedians. Again, those are things that expose ourselves, because when we have health issues and when we are in the middle of a pandemic and we see a lot of death and hurt happening in the world, sometimes that's where our brain just wants to keep going, right? But we also know there's a lot of love and light going on in the world. And just like today, spending this time together, that we're not alone. We can be with each other in our sadness and our hurt, but we also can be with each other in our joy and our happiness, right? We kind of need both. And that's what it is. So that's an example of a guided imagery. And again, that one was just called Smile and Be Happy. There you can find any kind of. So I talked about in this meditation about positive affirmations. It's important that we want to create this, and maybe you guys do this when you look in the mirror or however you do it to yourself. But I've just wrote some that I like to say, I'm ready for anything. So the next time you guys have to go to the hospital or the medical appointment, you just kind of say, I'm ready for anything, I'm ready for it. I'm successful, I'm strong, I'm open to seeing things differently, I'm happy. These are just ways we can have positive affirmations to help us. Get ready and just say, we can take this on, and this is part of building your resilience bank, right? I am on an app, it's called I Am. There's a lot of affirmation apps out there, but the app I'm on called I Am, it sends me positive affirmations throughout the day. So like I'm gonna read you one I got just now. Because sometimes during the day, we're not going around doing these positive affirmations. The affirmation that popped up before I came on with you guys said, I am the creator of my day, my weeks, my months, my years, and I choose to create joy and happiness. So you can get apps on, you can see it probably not with the white on white, but there's what apps out there for that. Oh my God. Thank you, Janet. That's a good one. Okay. So flowers, flowers, and more flowers. As you grow the flowers in your mind, you grow new neural circuits in your brain. So again, it's just saying we have the power to weed out those weeds, that negative bias that our brains are geared towards, and we can start filling in more fertilizer so that we can cultivate more positive, happy thoughts and a reservoir. I call it a reservoir, so that we have that to pull through when we have difficult days. So I've done this. This is for those that know me. This is one of my favorite loving kindness affirmations, and certainly we'll have some opportunity for some questions and comments on what you guys do to fill your, keep yourself in a positive state, especially when you're having difficult days. But I hope you all can see this. So how this works is we're going to do it together. And you repeat 3 times the following phrases. So if you guys can join me, that would be great. So I'm going to read each one 3 times. And again, these are ways that you can, again, fill your bank on staying positive. So the first affirmation we always want to give ourselves. All right, so I'm going to start. May I be safe. May I be happy. May I be healthy. May I live in peace. And you guys can join me. May I be safe. May I be happy. May I be healthy. May I live in peace. May I be safe. May I be happy. May I be healthy. May I live in peace. So now we want to give it to all of us in the room, and we're all on Zoom. We're not in the room today, but now we want to give it to each other. All right, so here we go. May you be safe. May you be happy. May you be healthy. May you live in peace. May you be safe. May you be happy. May you be healthy. May you live in peace. May you be safe. May you be happy. May you be healthy. And may you live in peace. And then we want to give it to the world. It's important, we recognize that the world is suffering, other people are suffering. So we always always like to extend my kindness and love to other people I don't even know. All right, so we're going to give this out to the world. May you be safe. May you be happy. May you be healthy. And may you live in peace. May you be safe. May you be happy. May you be healthy. May you live in peace. May you be safe. May you be happy. May you be healthy. May you live in peace. That's it on my program, but I'd love to have some questions and feedback and all that from you guys.
Mel, can you stop sharing so that we can get back to the main screen and see everybody?
Maybe. I gotta figure out how to get back to there.
Down on the bottom, you should have where you were able to find it to share it. If you click on the screen. Oh, there you go. Excellent.
Let me get rid of this.
Okay. So what we're going to do now is we're going to open this up. If anyone has questions for Melanie, please ask them now. We'll get to you if you raise your hands or whatever. And then we're just going to extend this to be a regular support group so that if people have anything you want to say or comment on, feel free to do so. If any of these caregivers who are here have any questions, I see Daryl has an incredible caregiver. So anyone want to ask some questions? Go ahead. What is your name, by the way, James White?
My name is Jody, not James, but it's on his
Okay,
email
Jody,
because we
thank
couldn't
you.
figure out how to do it. Sorry, guys.
That's
I mean, it
okay.
was just too complicated for my brain. But I have a problem with this. She's nailing it. And I think what's happened to me, I have CREST syndrome. It was diagnosed 15 years ago. The whole thing is done. My problem is the severe gastroparesis. I am nasty when this comes up. Can't handle, like the doorbell ringing is going to stress me out to the point where I don't know how to handle that. Because I get very reactive to people in my life when I'm really, really sick and I don't know what to do with that. When I started to do, like, for instance, I had my mother up and I needed help. It was stressing me out. So instead of dealing with it, because I felt myself reactive, I asked for help from my husband. But now I'm starting to feel like I'm becoming dependent. I'm asking help for everything. I can't handle anything. I don't know how to handle the balance. It's a balance, I guess.
Well, I certainly have some feedback, but I want to hear from the other group. I mean, I know some of you struggle with the same situation that Jody's struggling with, when you need help, but you don't want it and you're frustrated, and then you go through that cycle of emotion. Does anyone out there want to give feedback before I do? Or something that you do?
Spend a lot of time. It's hard, very hard. Feel isolated, abandoned. Those are the type of things.
Yeah, and I think that's where this helps, not knowing you're not alone. But I guess what's coming to me first to you is having self-compassion. That's what I feel like telling you, is like I'm holding my heart to say, nobody's perfect, right? And we all have our days. We just don't behave the way we're proud to behave. We all have situations where we react in a way it feels like, wow, I didn't handle that right. So just kind of have some self-compassion. And then maybe it's just doing some deep breath, counting. I don't know if you guys remember when you were young, your mom would say 1, 2, 3. If I get to 4, and you'd all like straighten up. There is some truth to that. And I sometimes do that to myself. I'll say I need a 1, 2, 3 for myself, because if I get to 4, then I know I'm gonna, so try to come up, experiment what works for you, and that can kind of help you get your emotions a little managed. But if you have a time you explode at your caregiver, or you say, it comes back to self-compassion, coming back and saying to your caregiver, listen, I know I was just not a good person, and I apologize, and I'm going to keep working on it. So, you're in it together. And your caregivers see you at your best, right? And sometimes they see you at your worst.
Absolutely.
Yeah.
Lisa has a question.
Yeah. Hi, Lisa.
Hi, so for me, I experienced that, but I've been learning from last year to look for the good all around me, because it is. So what I start doing a few weeks now is do a gratitude. I ended up
That's a
having
good
that
idea.
instead of a diary, and every day remind me to find one thing that I'm grateful for. So even my darkest day, and when I don't get help, and my emotion take over, this app will remind me at the end of the day, look, write one good thing that I'm gratified for. And sometimes it's just simple, it's raining because I love rain, or it could be I'm alive, you know what I mean? So to me, I find it by just choosing to be grateful, even if it's daily, find one thing.
Thank you, Lisa. That's a beautiful thing. I didn't even put in my presentation, but a gratitude journal is great. So when we have those hard days, it helps us kind of go back to, or you can hang it up. And I also want to say this, I like what Lisa mentioned in that sometimes when I have a bad day, like just a bad day, and I know for you guys, you have some really tough days, I try to remember I had some good moments in that day. So the good moment might be, hey, my favorite soap was on and I felt well enough to sit and watch it. Or the moment might be the dog came up and laid on your lap and you were able to allow him to be. So instead of saying my whole day was terrible, that goes back to what Lisa was sharing about gratitude. Kind of break it
Makes
down
sense.
and say, you know what, I had some good moments. I had some bad ones. Some things were tough that day, but I had some good moments. And that also helps us kind of not focus on all the negative.
Yeah, I think actually beating yourself up is not a good thing, and I find myself doing that all the time.
Yeah, it's that darn brain.
The brain,
Yeah.
the brain, the brain.
the brain, that negativity bias where we can start doing that self-loathing. I think Gwen, you
Yeah,
wanted to
go,
say
Jim.
something?
Yeah, I've been working on this exact thing. And what I've been doing is I'll have a really horrible day. And then I'll remember that I did a Tai Chi class online, and I did a weightlifting class online, and I walked 2 miles. And, and I remember I'm trying to focus on, wow, look at all these great physical things that I did today. And and it helps me. It gives me strength because it reminds me there's no one to tell me, oh, you did a great job today, because I live alone. So it's very important to tell yourself, look what you did today. You cleaned the whole house, or you did your weight class.
Vacuum.
And I switched from 3 pounds to 4 pounds, and that's fabulous. So yeah, those are the things I try to remember at least once a day now. And also I think daily gratitude is a terrific idea too. There's some stuff online about that. There's a lot of stuff on, you can just keep a journal that way. But yeah. So. And affirmation, great idea.
Yeah, wonderful. Thank you. Anybody else have something they kind of wanted to share with the group? Beth, hi Beth, I didn't see you in there. Your little box. Nice to see you.
Yeah, I just want to say, yeah, focus more on the things you can't do. And like, if answering the door stresses you out, maybe get a Ring doorbell and see who's there. And if it's nobody you don't always have to answer the doorbell. You don't always have to answer the phone.
Good advice.
You choose, and you have to change your mindset you choose what you want to do.
Right.
So I
That's the
think,
problem.
that's an important thing.
That's great advice. You're right, Beth. Mhm. Put some
Absolutely. Thank you.
control when you're feeling out of control. There are things you can put back into your wheelhouse that you can control.
Right.
Yeah.
Thank you.
Good to see you, Beth.
Thank you, Melanie. It's good to see everybody.
All right, Bonnie.
All right, can you hear me?
Yeah.
Okay, so 2 things. Not suggesting necessarily that this be you, but if you just are aware of anything. I belong to Codependence Anonymous after a bad marriage. And I have trouble with those meetings, to be honest, because I get triggered really badly by listening to everyone else's experiences. Like, it just is so emotional for me. I was just thinking how nice this is. I wish there was something like this specific to our disease. I know Fern does a nice job with the regular support groups that I always have to work during. But I wish there was something like this online, like there is for CODA and Alcoholics Anonymous, that when you have a disease like this, that you could have like a mental health expert there, and a forum like this where we can all see that we're not alone more often. I don't know if there's anything like that, but I wish there was. Even if it was chronic diseases, period, and not specific to scleroderma, if we all could see each other and like have this kind of a format, would be unbelievable, healthy for all of us.
I believe that too. Absolutely.
Yeah.
I totally
Thank
agree.
you. I don't know, it's more Fern's category. I don't know if the National is coming up with something like that or not.
Well, I'm certainly going to suggest it. Thank you, Beth.
Okay.
Yeah, it would be so nice. And they can just follow like a CODA format where we all like read something with positive affirmations. And like we have a book we read from of like personal growth things that you're working on. But you're all supposed to read the chapter, and then you get together and you tell like what good or bad thing happened to you that week and how you handled it and how you grew. And you're not actually allowed to comment on each other, which is what's really tough. And say, well, you could have tried this, like how she did with the Ring doorbell. Like, that's an absolute no. You're never allowed to give those kinds of suggestions because you're not supposed to fix other people. But I love that you can in this group.
I like it too.
I like the idea of sharing because you do get so mired in and stuck in your problems in your life, and you don't have to take someone else's advice, but it's just nice to hear someone else's perspective. And that's the one thing I would say about CODA that bothers me, is that you can pour your heart out and be bawling, but no one can say anything.
But it's awful. That's
So,
great.
so for me, it's torture as a caregiver and a person with an illness. It's torture for me to say nothing if I might know something helpful. So, so anyway, I just think that that would be, when you present it to national, if you could just mention that a format where we kind of read something and work on personal growth, but then when people get a chance to ask each other, or vent to each other, that they would be able to do that. I think just because nobody understands unless you have a chronic illness. And the second
Absolutely.
thing I wanted to say, which is really selfish and pertains only to me, but hopefully it isn't too bad for the rest of you, is I did get divorced during the pandemic. Certainly my disease was a part of the marriage downfall, but it was going to downfall anyway. That's why I got sick, I believe. And so I'm now in the just starting to date phase. And I don't know when to tell them that I have this disease. Like some of you, your fingers are crippled, so it's really obvious. You know, when I get out of a car, it might be obvious because that's when I walk like I'm crippled for a few minutes till it all stretches out. My biggest symptom is fatigue. And so I don't want people to think that I'm lazy or that I'm old and I can't do anything, but I definitely can't keep up with other people my age. And it does get to be noticeable pretty fast. I told one person and he automatically panicked and thought maybe it was contagious and he might get it from me. So I just wondered if anybody out there has any comments about, do you tell people the first time you go on a date with them? Do you wait to share this very personal stuff to date 5? Like how are we supposed to share this with people?
That's a good
Does
question.
anyone have some feedback? I know I don't see Jessie. Jessica's not on the call today. Is she?
That's the person that we need right now to.
Yeah. We have one of my BFFs. She's
Yeah, I
in
know
the
her.
dating world.
I mean, I know of her from the meetings.
Yeah. She kind of, I know for her, I don't want to speak for her, but I know for what she's told me is she's pretty upfront about it in the beginning. But for her, you can see it. So for her, she has to it's the elephant in the room right away.
Right. Yeah.
Yeah. So, I don't know. Does anyone have any feedback on that for Bonnie? That's kind of a nice switch. We're going over to dating.
If it's someone she's meant to be with, no matter what time she ends up telling them,
It won't matter.
it is
Accept
what
it.
it is. You
Right.
know?
That's good.
Yeah.
Excuse me. I gotta get out of here.
Still got to live your life. You still got to date. You still got to do those things.
Yes.
You know, don't have that hold you back.
Don't let it hold you back. Yes.
Because everybody's different, you know.
And if he accepts who you are, that's.
And I've been with this one 20 years, okay? 20 years together. And we've gotten to the point where we try and make jokes and laugh as much as possible. Because if not, you know, there's times you'll cry. So you really have to keep that, you know. I know that the disease is no laughing matter, but we try and keep it positive and joke and laugh as much as possible.
I say that laughter is definitely the best medicine, and I don't laugh enough, and I'm always like searching for things that will make me laugh. Like my son loves to pull up these try not to laugh YouTube videos. It's a whole series, try not to laugh.
Yeah, those are fun. I've seen this.
So we were watching some last night, and I do think that stuff helps as well. But I'm always torn between making the disease like it is the elephant in the room, but making it like the number one priority in the room. I've always tried to look at this disease as like a backpack I just threw on my back and I keep going.
Yeah, no, don't let this disease define who you are.
Exactly.
Right.
Right. And as far as
Right.
telling them when to tell them, like on the first date, you don't even know the person very well.
Right.
I would wait till you feel comfortable and you know the person and have like you decide to keep dating them, and maybe that's the time to tell them. But I don't think like the first date when you first meet them, you just throw it out the very first thing.
I know, I feel like I'm sharing sometimes.
And if they're gonna run, then you don't want them in your life anyway.
I agree completely.
That's
I agree
right.
completely. But I don't necessarily want to tell them and have them run after one date. Like then it's like weird that I told them and they ran on one date. I don't know. Maybe it's better.
Right.
You'll
That's
know
right.
when
Better
to
they
tell
get
them.
to know you
That's the
first.
point. That's it.
Yeah, absolutely.
That's not the right person
And the
for you.
fatigue, I have chronic fatigue, and I
Yeah.
know what that headache and it's no fun. I
No,
mean, your brain wants to do one thing and your body wants to do something else.
Absolutely.
For me,
And it's
it's
a
more like,
battle.
it's more like a little child sitting in their high chair eating, and you look over and their head's bobbing, and then their face plows into their food and they keep on sleeping in their food. Like, that's how it feels to me. Like, it's literally physically painful to stay awake.
Absolutely. I know exactly what you're going through and I'm so sorry. I hate it for you.
Yeah, thanks. Yeah, I hate all of this for all of you, and I feel lucky I don't have a lot of this stuff, but that's the thing that's really kicked my butt for sure.
Yeah.
Can I say one thing?
Mhm.
Yes, absolutely.
Get on this thing.
You're on. Just talk. You're there.
Clear.
Jody, turn your second mic back on.
Did I get it?
Yeah, you got it.
Yes.
I have to remember what I was going to say because I'll probably forget. What I was about to say, which is probably what is about to happen to, the fatigue. I want to talk about this for a minute. I ended up so fatigued that they thought I had MS in the beginning of this mess. I was at the doctor, the neurologist, the whole mess. Thinking it was MS. I was trying the ABC protocol. I mean, it was crazy. Ends up with this, but I had this chronic fatigue I couldn't control. Ended up to be narcolepsy. So I just want to throw that out there, that this could be part and parcel. I don't know if it's because of it, if it's an extra added on coupon I got, who knows? But I got it. I had a rollover car accident because of it. It's serious. When you feel that exhausted, it may be worth it for a sleep test.
I actually got tested for that long
You were,
before the
okay.
scleroderma diagnosis. It was my first symptom of scleroderma was the fatigue.
There you
So,
go.
so for the first 4 years, I got worked up for everything, right? One other thing I should mention to all of you, that you should mention to other people, and as a clinician, I do to my patients all the time, is I've been diagnosed now since 2016, and for 4 years before that, Quest missed the diagnosis, and I want you to know that it's now 21. So we're talking, what, another 5 years, and Quest continues to miss my diagnosis. It does not ever catch my clotting disorder or my positive ANA or my scleroderma, ever. It missed it every single time. I have nothing wrong per Quest.
Wow.
I'm 100% normal at Quest Diagnostics. It's only LabCorp and then the RDI, the specialty lab, that ever catches me. So whenever my patients say I have all these autoimmune symptoms, but my ANA is always normal, I always say, if you're getting it at Quest, I would not count on it being accurate.
Really?
No, not one time has it caught me, never.
Jeanette?
No.
Jeanette? Check into that. Oh, you're still on mute, Jeanette.
I gotta take it off.
Yes, I was
Yeah, we're
thinking
gonna have to
about that
go.
because, I mean, I've always tested positive, but I only go to Quest. But, my blood work is always all messed up regardless. I have deficiency in a whole bunch of stuff, inflammation
Same
in my
thing.
whole body. It's a hot mess.
Me too, but not a Quest, never.
It's like a Christmas tree. You're high, low, high,
Yeah.
low. That's how mine is. It's
Yeah, I'm
never
a hot mess.
full range.
And he has all.
And am I the only man in the group? I mean, I'm
I
out.
think so.
Daryl.
Daryl, we have a few others, but they don't always show up, and we're really glad that you're here.
Yes.
There is a group just for men to discuss men's
This is
issues,
pleasure.
a special group.
So immature. I'm so sorry. But she's the best caregiver ever. And I'm lucky to have her.
We love our
But,
caregivers.
We do.
I mean, having this disease for so long, progression, I worked through its progression, and that was not easy to, I'm a perfectionist, and it just like kills me not to be able to do things in a perfection way, especially keeping my body perfection impossible.
The energy.
And the energy is gone, it's depleted. So I'm so
Daryl,
sorry.
down here in South Florida?
I'm in South Florida.
Oh, okay.
So you're gonna
Mile-
talk about the men's group?
I'm sorry?
So he needs to know about the men's group with. Lee
Yeah,
Forrest.
I'll send you the information.
So I call Lee my sponsor. He's the first person I ever met with scleroderma, and he introduced me to Fern and the rest of the group at the conference. He's a really great guy, and because men have their own separate issues and feelings about the chronic disease, he formed his own group that's a men's group only, and no women are allowed, no caregivers, nobody that's a woman whatsoever. It's men only, and so he holds that, and so a lot of the guys are in that too.
Wow.
I will connect you with Lee, Daryl. No problem.
Awesome.
Wow. It's not that I don't like, being around.
Well, we want you in both.
I'm always surrounded by women, everybody. So I just thought it was more in women than it is in men. So
It is. Richard's not here, and Richard's been here a few times as well, and he signed up, but I see he didn't get here.
yes, and I was fortunate to run into someone who has exactly what I have at my room at the hematologist, and it was just a meeting she's never seen anyone who had CREST, the same thing, the same symptoms. Jessica.
Yes, he ran into Jessica just a couple of days ago, and that's how we made the connection, and I got him the information.
Jessica.
Yeah.
I University of Miami and waiting to have an infusion, and had her there. I only got to speak with her for about 10 minutes. And she's the one that got me hooked up so I can be here today.
Well, when we have our regular support group meetings, she's been leading the meetings, so you're more than welcome to come. I'll put you're on the list, and
Awesome.
A lot of us are connected through Fern on Facebook too.
Yeah, on Facebook. Yep. We're doing
I gotta
Facebook.
say, I've got to leave this group. I'm so sorry, but I have to go to pharmacy before it closes. I want to say goodbye. I feel bad, but I have to sign off.
Thank you for
Nice
joining.
meeting you.
Bye.
Thank you guys so much. This was great for me. Thank you.
Great too.
Nice weekend.
Thank you.
Take care. I got her off with go.
I'm so happy you joined.
Else want to, address Melanie before we putting this all down? And first of all, you guys have been incredible, and I love the questions everybody's answering, but I'm more than that, I love the support to each other.
I can't do this all day. If I
Don't
listen
you
to what
sit
people
there.
are telling them, I'm gonna die.
And you guys do an incredible job of supporting each other. Absolutely, Bonnie. I'm going to address that with the national office. I think that's a wonderful suggestion. I know that there have been presentations on mental health all along, kind of like we just did here. But the idea of having more of a support group kind of a thing is really great. And we will certainly put that to our national office. And now I'm going to do a couple of commercials, because on February 26th, we are going to have our walk in person. For those of you who've been there, you know what an incredible event it is. And we are going to be back at Tradewinds Park. The information is going to be going out as soon as the website is up. I'm still waiting for that. We're going to be sending that all out to you and getting that going, and start your teams and support. And just know one thing for everybody here in the room that hasn't been there, it is one of the better days you'll ever have in your life when you see how the community comes out and how you are supported. The second announcement is something that has just recently been finally finalized. 7 years ago, August 15th, we did an event called Laugh Out Loud for Scleroderma. And we had it at the Improv at the Seminole Casino. And we are about to do it again this year at the Lauderhill Center for Performing Arts.
Right.
And our guest will be Randy Rainbow. For those of you who have not seen or heard of Randy Rainbow, go online. And can I say that, Gwen?
Can you say what? That he's the best thing you'll ever see?
Yes. As the proud mother of Randy Rainbow.
Three-time Emmy nominee, and yeah, go see him. Yeah.
Go see him, but go online to randyrainbow.com and you'll see what Randy does. He's an incredible performer, and he's going to come to South Florida to support us and help us have an incredible fundraising day. May
Awesome.
13th, 2022. And our walk is February 26th, 2022. You'll be hearing more from me very, very soon once we get everything up and running and get our tickets in line and all the good stuff that's going to be going on. So, and of course, our monthly support group meetings, we will have one in February, the third week, which will be the week before the walk. And what else? Anything? Here's our president.
Hi, everybody. This was fantastic. You know, we love doing, oh, by the way, my wife Nancy's sitting over on this side, our treasurer. Wait, let's, whoop. Are you in there? What have you? Where is she?
Nancy's been.
There she is. Okay.
Hi, everyone.
So, all right, back to the beginning. We're looking forward to the events coming up, especially that we're able to do things in person, not on Zoom. Let me say that again, not on Zoom. We want to see everybody, and really, this walk is going to be fantastic this year. A couple of surprises coming up. You'll see about it later. And that's about it. And why am I opening that up? Okay, I don't know either. So, thank you, everybody.
Let me say one thing about the support group meetings. The support group meetings will continue to be virtual because we are reaching the entire state. We're going to try to do, once we get clearance to do in person, maybe we'll do a little lunch or dinner somewhere in between the 3 counties so that we can see each other in person, masked, vaccinated, et cetera, et cetera. But for the meantime, all of these support groups will continue to be virtual. I don't. Okay. We thank you all for coming and thank you all for your support. Okay.
Thank you.
What?
Everybody, be strong, be well, be safe.
Thank you.
Amen.
Thank
Yeah.
you.
And thank you for
Thank
getting me
you.
on.
Yes,
Be healthy.
don't worry, be happy.
I
Let
like
go,
that.
let
I'm
go.
gonna be Mary.
Yeah.
I'm signing off. Thank you
All
very
right, bye, everybody. Thank you.
Bye.
Bye.